Periods can be a challenge for anyone, but did you know they can be worse for someone living with sickle cell disease? I'm Dr. Sharice Chambers, a board-certified OBGYN, and I provide education on topics related to periods and reproductive health. If this interests you, be sure to subscribe to my channel. Now, let's talk about how sickle cell disease may affect periods. Sickle cell disease is a rare blood disorder where the red blood cells are sickle-shaped instead of round. Because of their shape, these cells don't flow through blood vessels as well and tend to stick together. A sickle cell crisis occurs when these cells clump together and block blood flow to certain muscles, organs, or even bones. This leads to pain that can last from hours to days and range from mild to severe. Studies have shown that many menstruators with sickle cell disease experience pain crises around their periods. This often occurs during their period or in the week leading up to it. One study found that 58% of the participants had pain crises that corresponded to their menstrual cycle. 37% had a crisis each time they had their period. A different study found similar results, with 1 in 3 of the participants consistently having a pain crisis during or shortly before their period. Outside of triggering pain crises, sickle cell disease may actually delay the onset of menarche, with many getting their first period later than average. A 2023 study conducted in Atlanta, Georgia, evaluated adolescents with sickle cell. The mean age of menarche, or very first period, was 13. This is just slightly later than the average of 12 and a half years old. Although sickle cell disease is associated with increased blood clotting, adults with sickle cell are known to have an increased incidence of bleeding, including heavy menstrual bleeding. In this same study, 42% of adolescents with the disease also reported a history of heavy menstrual bleeding. Additionally, 61% reported moderate to severe dysmenorrhea, or period pain. Adolescents with severe period pain or heavy menstrual bleeding had questionnaire scores corresponding to worse quality of life. The real kicker is that despite the high prevalence of heavy menstrual bleeding and dysmenorrhea, less than 20% of participants had attempted any hormonal therapy for menstrual regulation, and the majority didn't use painkillers to manage their menstrual pain. Living with sickle cell disease presents many challenges, but period challenges in healthcare are more likely to be overlooked, underevaluated, and undertreated. If we understand how sickle cell disease may affect periods, we may be more likely to discuss our concerns with healthcare providers. By normalizing period discussions early, especially in patients with complex health conditions, we can hopefully find ways to decrease discomfort, manage bleeding, and improve quality of life. As always, I'm Dr. Sharice Chambers. Thanks for watching.